Hi, I'm Toby, I'm 35 and my own body is trying to kill me. So those of you who've been watching know that I've got my assessment to go onto the liver transplant list coming up soon. Obviously I've been quite nervous about this, but luckily the other day I received this nice little information pack, and let's have a look through and see what we've got here. So we've got a leaflet on living related liver transplantation, information for people considering living liver donation. That's quite handy because I've had a lot of people actually asking about could we give you part of our liver? Yes, that would be possible if I'm going for a partial liver transplant. I'm not sure if that's the case. I think that will only come out after the assessment. And it depends on a number of things, including the health of the person donating and obviously blood types. The other thing I've got two sets of information about optional research I can take part in. Both of those studies, in any of these research studies, you can actually choose whether or not you do want to participate. I've got a timetable here, which looks suspiciously blank for me. I'm not sure if this is just because it will be filled out more when I'm there, or whether because my liver consultant has been so on top of things, we've actually done most of the tests already, and I may actually only be there a lot shorter time than usual. Originally I thought it was 2 days. However, in the information pack, which is a nice big wad of information, it does actually talk about stays of up to 5 days. I'm pretty certain I will be there only 2 days, again because I've had most of these tests done already. In fact, if that timetable is correct, I may even only be there 1 day, but we'll see what happens and I'll keep you guys posted on that. So let's have a quick look at the nice big wad of information. This is the pre-liver transplant patient information booklet. So on the first page we've got a nice little list of people who will be involved in the transplant. So this is a transplant team, and it actually names all the surgeons, physicians, transplant coordinators, clinical nurse specialist in drug and alcohol dependency. I'm assuming I won't need to meet that nurse. Consultant anaesthetist, a consultant intensivist. If anyone knows what that is, please let me know because I have no idea at all. Surgical specialist registrar, transplant specialist registrar, anaesthetist specialist registrar, specialist dietitian, specialist pharmacist, social worker, house officer, research doctor and nurses, psychologist, ward sister, charge nurse and ward nurse. So there's quite a lot of people involved in this whole transplant process, and I will meet most of these people who I will be involved with directly when I go for the assessment. You notice as well there are people in there like house officers and social workers, psychologists. So they're not just looking at the medical side, they're looking at your social side as well, and your financial and housing situation. All of that kind of stuff comes into play. Next page tells us a little bit about the transplant coordinators and exactly what they do. Now we've got a bit about the liver. A lot of that I've kind of mentioned to you before. Signs and symptoms of liver disease, again as well, I've already spoken to you about that. And here it tells us a little bit about the assessment. There's not really much on the assessment there that you haven't picked up from what I've said, and I will go through it in more detail as I'm going through the process. One of the things that I maybe have not mentioned is you must have a next of kin with you to go along for at least the one session they call the educational session. If you don't have that, you won't go on the list. Now we have a list of all the different investigations. So they've got a list of other specialist assessments as well. So anaesthetic assessment is basically they check that you're fit and healthy enough to be anaesthetized and then wake up again. Nutritional assessment, we'll look at what you've been eating, talk about what you need to eat, and then check for muscle wasting. Yeah, that could be an interesting one. Because I've lost a lot of weight recently, my muscles have deteriorated. I need to build them up. I haven't been very successful in doing that yet. So they will probably say something about my lack of muscle here. Hopefully it's not so bad that it's an issue, but potentially they could turn around and say, we can't go ahead until you've built up some of this muscle because your body won't have enough energy to survive. The social worker, so it says here, the social worker will meet you during your assessment. They can advise and help you with any specific issues you may need assistance with in relation to family, employment or financial problems you may be experiencing. So actually it'll be quite reassuring to be able to speak to somebody and get a more concrete head around all the situations there. I still need to look up benefits and things, and I'm still a student, so I don't know if I can claim any benefits and so on and so forth. So that's something that's still kind of bugging me that I need to get sorted. Again, list of more tests. They mention the hospital chaplain, and they do say, see, I'm not religious, but they do say the chaplain is there more as a counsellor rather than a religious role. Interpreters if you need it. There's a liver support group run by liver patients that you can phone up. And okay, so let's have a look. The transplant assessment meeting. As I mentioned, I have this meeting, blah blah blah. So this is the meeting they have after they've met with me, and they have with all the specialists, and they decide whether I go on the list or not. And they say there's 4 possible outcomes. Either they say, yep, you're fine to go on the list, done. Option 2, they decide I'm fine to go on the list, but I'm too well at the moment, and they basically say, come back if your health deteriorates, and then we will put you on the list. Third option, may require further investigations. Or fourth, they may say, actually, we don't think you're suitable for the transplant. This could be due to a whole number of different issues, and it's not a final decision as in once you've been rejected once you can never apply again because your health situation changes. But there are certain things, like if you are found to have other illnesses or diseases, then they are less likely to put you on the list if they think that you're not going to survive. So once you're on the waiting list, it talks about you could get a call at any time. Waiting list is divided into blood groups, and then the donor livers are matched to the recipient according to blood group, weight and height. So obviously if you're like me, you're a grown adult, I can't take a liver from a child because it'd be too small. And likewise, a child couldn't take a liver from me, apart from the fact that my liver doesn't work. Although I believe, I'm not certain on this one, I believe there are options for a child to have a partial liver transplant from an adult. I'm not quite sure how that works. If you become unwell, you could be suspended off the list and then put back on when you're better again. It says here, if you have alcoholic liver disease, basically stop drinking. If you don't stop drinking, we'll take you off the list. And here we go. So there are types of donor liver used. First one called brainstem death donor or heart beating donor. So this is one of the live donor type situations. And what they do here is when somebody's due to be taken off life support or something similar, with the agreement of the family, they take the person into surgery and bring the liver transplant recipient into surgery at the same time, so that the time that the liver spends out of a body is absolutely minimized. So out of a living body is absolutely minimized. The non-heart beating donor is when somebody has died, for example, if they're taken off life support when they're in the hospital, and as I imagine probably most families would want to be there in this person's final moments, so they aren't taken away until after their life support has been switched off and they've passed on, and then they're taken into surgery to have the liver removed. The living related donor, so that's the ones I was talking about, and that can be either full or split liver. And there's something here called HBV core positive donations, which is something I was completely unaware of. So apparently if the donor's had previous exposure to hepatitis B but has cleared the virus, apparently that liver can be used, but the recipient will have to have a lifelong medication to make sure that the virus doesn't reappear. And finally there's one called domino livers, which is I find a bit weird to understand, but as I understand it, the one person's liver isn't functioning for them, but would work for somebody else. So to maximize the number of livers available, if a transplant liver becomes available, they take that and their liver is then put onto the transplant list for somebody else to have. So you have this kind of domino effect.